Hello, my name's Gavin. I work at Atkins Physiotherapy here, and what I'm going to show you today is basically the IDD machine. Just explain a little bit about it and how it works. So basically the IDD machine is a machine that causes a traction to your body, okay, through this belt here, okay, and the idea is it can work at either your lower back, your middle part of your back, or say your neck, okay. So here, this part here, we have where you can actually fit everything to the neck, and down here this strap, this connects to one of these harnesses, okay, and the idea that can pull the lower part of your back. This bed works specifically at different levels. Unlike traditional traction, you can actually specifically get the area that you want to treat. So if you have, say, a lower lumbar problem, say L5 or S1, then you can actually put the information into the machine, and the machine will specifically pull at that area, and the idea of treating specifically, whereas normal traction you wouldn't have that, you just get the whole area being pulled or the whole spine. Now over here, what we normally do is we enter patient's details into the screen, and here we have a patient database where we put their information in, and everything is held on this computer. And what we normally do is when someone comes in for an assessment, we normally use different assessment markers to measure where they are. So say their pain scores and different scores that we actually use to work out. We also weigh the patient as well using the scales, okay? And by our assessment skills, we use different braces, okay? And we have one for, say, the lower part of your body. So they've got that harness there, and we have one for the upper part, and depending on the patient itself and what they need. Now IDD, okay, the treatment normally lasts for roughly about an hour, and when someone starts their treatment, what they will normally have is a heat strap, okay, which they have on for, say, 10 minutes. And then once after they've had that, they will go onto this machine. So as I explained earlier, we're put in different settings. Now this machine, the great thing about this is a person or a patient can come onto this machine and they can actually start from standing. So if I show you, so here you can see the machine rising up, and it brings the patient up to a standing position. So you can end in this position or you can start in this position, okay? And this makes it more comfortable. And also we can control a patient, how they come up, so how they accelerate upwards or decelerate downwards. And that's good as well for people's blood pressure, because obviously if someone's been lying for a while, sometimes they can have low blood pressure, okay? And when they're ready to start the treatment, what we then do is we lower this bed down, okay? Once it's completely lowered down, as I explained, we put a harness on, we attach this strap here, and if you look up here, we have different pads that you can see. So over here we have, say, a pillow for the neck to make sure they're comfortable. And up here we have pillows for the knee. If you can see underneath there, that also basically goes where the knee, so that's, sorry, I explained the knee, but more ankle, just below the knee. And you have this here, depends on their, say, leg or thigh length, we can adjust that pad. And here behind, we have different pads which then go into the side of the patient, okay, to make it so they're comfortable when they're having treatment. Now after their treatment, which is normally on this is roughly about 25 minutes, maybe 26, but you can adjust them treatments as we go along. The patient would take their pain scores again, and most of the time it's lower than what it initially was, and then we will apply an ice pack to their back for, say, 10 minutes.